Robert Moser. He was born in Denver, Colorado, and raised in Tribune, Kansas, attended the KU School of Pharmacy, KU School of Medicine, and completed his residency in family medicine at the Smoky Hill Family Practice in Salina, Kansas. Dr. Moser practiced for 22 years in Tribune, building his practice from one physician to a healthcare system with 5 physicians and 3 mid-levels that covered 3 counties in western Kansas. In 2010, he left Tribune to join the KU School of Medicine, Wichita department as the Director of Rural Health and Outreach. I don't think he ended up there very long because he was appointed to the Secretary of KDHE in January of 2012. So please welcome Dr. Robert Moser.
Boy, I just love rooms like this. It feels like we've got an opportunity to lecture. No. I am glad to be here this morning to welcome you, and again, I want to echo Rachel's comments, particularly for the providers taking time. It is important that you get engaged in the number of processes that you're being held accountable for, that we get input from you, because I can tell you that I was also a regulated entity as a physician running a rural health clinic and also being medical director of nursing homes. I always enjoyed when the state inspectors showed up. Look forward to it, as a matter of fact. No, I understand the anxiety that goes with the survey process, and understand that whether you're talking about health care, child care, but most of what we do, we go in with the idea of providing a healthy and safe environment and doing our jobs. And I can tell you that if we don't get input from those that we regulate, then sometimes we don't understand the perspective or what the impact may be at the local level. And I think that's critical to have that feedback. Now, if you volunteer for a number of these programs to provide information, participate in communicating what's working, what's not working, and whatnot, just think what can happen. The more you complain, you get asked to be secretary. Because that's kind of what happened to me. I truly do believe that all the efforts to make sure that folks in Topeka and Washington, D.C. understood what it was like at the practice level, so to speak, is what gave me the opportunity to do what I do today, and I feel pretty fortunate in that. So remain engaged, advocate for what you believe in, participate. It's very important. I know it's very time consuming, and believe me, Tribune, for those of you who don't know where that's at, it's on the Colorado border. So to come to Topeka, to testify before committees or to participate was pretty much an all-day ordeal. Usually I would get up at 2 o'clock in the morning and drive because we're so far west, we're on mountain time zone out there. That would get me to Topeka at 9 o'clock, usually in time for things to start going on, and then as soon as the meetings were over with, I would drive back home to be ready for the next day. Now, for the 2 to 3 years that I practiced alone out there, that was very difficult to do, to find time. I couldn't get away for that, but as soon as I got a partner, I was very fortunate that they were supportive of me being able to take time off to participate, and I know you often have to find resources like that as well in what you do. Now, when I came on as Secretary of KDH&E, I was very excited because I knew a lot about what KDH&E did. I probably didn't know as much about the environmental side as what I currently do. Thank goodness those folks are patient and willing to teach me a lot about environmental health. But I can tell you that I thought we had a pretty successful agency, and I've mentioned to our staff that it's very easy to be an administrator when you have a successful agency, because the only thing you need to do for them is to provide them resources. Well, resources in the way of people and money. And as you know, the state has not necessarily been able to offer those resources, and yet our staff have been very innovative. They've been very dedicated and working diligently to find efficient, effective ways of accomplishing the work that we must do every day. As we look at an indicator system like this, I'm very excited about this because it does a couple of things. I think one, it finds a more efficient, effective way to utilize our staff time as well as the local health department, surveyor, staff time, et cetera. It fits right in with what we're doing on moving forward with electronic survey and communication. But more importantly, it rewards those that are doing a good job, so to speak. Again, I would love to have been able to do some of my rural health clinic and nursing home surveys in an abbreviated fashion, being rewarded for doing all the right things, having the right documentation, et cetera. That would have been nice because it was very disruptive to our clinical practice and our nursing home practice to go through a day-long survey. Sometimes it was a 2-day ordeal to go through. So anything that we can do to find efficiency that also benefits those that are actually delivering the services, I think is outstanding. So I'm very excited about this process. Look forward to seeing how this develops. It's going to be very important to get your input as this moves forward. So I really do want to say thanks for taking time to be here and to say thanks for what you do every day. Thank you.